Assalamu alaikum. Today we're gonna do a topic which is related to the general medicine. So let's start it. Bismillahirrahmanirrahim. Before the start of the topic, I want to represent a scenario that you can actually. The scenarios are very helpful for the patient to remember that particular topic also. This 30-year-old woman complains of double vision and accumulate and in coordination with the previous episodes of weakness. She had partial visual loss about 6 months ago, but it was improved by steroids. Now she had at least two incidents of urinary incontinence. Very recently, on examination, she has a breast reflexes and cerebral signs. So it is a classical scenario for the multiple sclerosis. It is a chronic, progressive, and degenerative disorder of the CNS which is characterized by disseminated demyelination of the nerve and fibers of the brain and spinal cord. So basically, it is a slowly gradually that affects the neurons of the CNS. In this, what happened? There is actually the myelinated neurons become demyelinated, and basically it is spread in the whole brain and spinal cord. Okay, the age which it affects is basically 15 to 50. Mean it can affect to young to middle and then age also. Women are more affected in this case. Now, the cause is unknown, but it can be infectious, immunologic, and genetic. Infectious, immunologic, and genetic also. Now, number one, we will talk about the infection. The predisposing factors are infection. Then we have also physical injury, emotional stress, excessive fatigue. We have also, and then pregnancy and poor health of state. Okay, so infection, then physical injury, then excessive emotional stress, excessive fatigue, pregnancy, and poor state of health. Okay. Now, multiple sclerosis. How the pathophysiology? First of all, to know about the what is myelin sheet. So myelin sheet is basically a segmented lamination that wraps around axons of many nerve cells, due to which the nerve impulse conduction in the axons increase basically, and the composed myelin has a high lipid content also. Now, moving towards here, how the pathophysiology. First of all, either there will be a chronic inflammation or and demyelination and gliosis in the CNS. Okay. Second, it can be also a virus in a genetically susceptible individuals or subsequent antigen antibody reaction that leads to the demyelination. So the demyelination of axons can be either chronic inflammation is responsible, or virus in the genetically susceptible individuals, or antigen antibody reaction that leads to this. Okay. Now, basically, when there is a loss of myelin sheet occur, okay, so there will be oligodendrocytes, which are lipid, will also disappear, and proliferation of astrocytes will occur. Plaque formation with the plaque scattered throughout the sinus will happen. Okay. Now, basically, what happens? Initially, the myelin sheet of neurons in the brain and spinal cord are affected, first of all, but the nerve fibers are not affected. Okay. uh, but the patient may complain of noticeable impairment of the function. Okay. And myelin can be regenerated and the symptoms may disappear. It is a remission can also occur in this disease. Okay.